Hello, my name is Debbie Bell, and on behalf of the Franklin County Health Department, I'd like to welcome you to Working on Wellness. I am pleased to be here at the Franklin County Public Health Center tonight, gearing up for our annual 3 for Free drive-through flu clinic. Many of you may be familiar with our drive-through vaccination clinics, which began in 2010 with the emergence of H1N1. In fact, some of you may have lined up for a shot yourself. But did you know that along with ensuring that our citizens are vaccinated against the multiple flu strains, our community is actively running an emergency preparedness drill throughout the event? I thought you might be interested to learn how your community is taking action to keep you and your family safe by testing their ability to respond in the event of a mass emergency. Some of the questions that we'll answer this evening include: how will we acquire a vaccine or medication necessary to treat our citizens? Where will members of households go to get medication and vaccines? How can the flow of traffic best be monitored, managed, or when people are afraid? And why consider a drive-through delivery system versus a congregating site? All of these things we'll discuss as part of our evening on Working on Wellness. Join me now as we go in and our volunteers are briefed.
What I'd like to do now is give you an overview of what we're going to be doing this evening and let you know exactly what is expected of you. So this is just-in-time training for everyone involved. We will be operating under an incident command system. We basically have four functions with the incident commander is Judy Mattingly. Judy, front desk. She's the director of the health department. I will be the safety officer to make sure everything runs smoothly and everyone operates in a safe manner. We have the pod operations, which it means point of dispensing, and the operations is operated by Tammy Bertram. And we need to thank Margie Buckaloo, the logistics, for making sure we had pizza and drinks throughout the operation. A very important person. The mission that we have tonight is that we will exercise the Strategic National Stockpiles Plan and Countermeasures Distribution. Even though this is a flu clinic, this is our way of practicing if we have a bioterrorism incident where we have to medicate the entire population of the county. The way we have it planned, we have 2 pod operations. One is here at the CCU with an agreement that we have with them. The other one is on Merrill Street that we have with the city. And the reason why this would be important is that we think that using a drive-through method of dispensing, we can move a large number of people through and distribute medication in a small period of time. We also tonight, because we are giving flu, we're protecting the community against influenza, and hopefully in this day and time with the Ebola, we need to have everyone not demonstrating symptoms that are similar. So the more people who can get a flu shot, the better off we are. And then also too, more people die in this country from the flu than just about anything, about 20,000 a year. And then also, a key component of this, we're trying to help feed our friends and neighbors in the community by collecting money for the food pantry of Franklin County. Again, the operation has 4 components. The traffic control component is that we have designated a route for this that will keep people off Kentucky 676, the east-west connector, as much as possible. So the beginning of this route starts at Coffee Tree Road, which is just west of here. It circles around Coffee Tree in front of us here on Glens Creek, turn right onto the east-west connector for a small period of time. Up Sour Avenue, we will loop around and then bring people back into the banking lanes at the Commonwealth Credit Union. Again, we are collecting food at the very beginning of this route, and the Kiwanis Club is good about assisting the food pantry and doing that. We will be registering the participants and then the medication dispensing. Some of you have worked this before and pretty much familiar with the route, but again, it will loop up Sour Avenue, which is one way. We will divert traffic into the left lane going up. When they get to this point right here where they register, they will be given a clipboard with the necessary medication information that they would need to fill out. The American Red Cross volunteers have volunteered to do that for us. They will go around and loop at the top of the loop. They will be diverted into the right lane. When they come down at this same location, the clipboard will be taken up and they will proceed with a registration form. They will go down to this point tonight and they will be stopped, and then it will be determined how many people are in the vehicle, and then they will be given a lane to go to receive the medication. In the past years that we've done this, our average time from the point of registration to dispensing the shot has been 7 minutes. So we think it's an effective way of doing this. Again, as I'm showing you, food collection first, registration, and then we'll move people on around. The Commonwealth Credit Union is going, as a good corporate citizen, provides every participant with a pen that they can keep to fill out the form with, and then hand sanitizer. We will also be sending a form through about every 15 minutes where we can gauge how quickly we're moving and how efficient we are. So those of you that's working registration, you'll see this form being given to people every 15 minutes. And then at the end, when they get the shot, the nurse will write in the time. So that gives me an idea of how long it's taken us to get through. Thank you. In this operation, we are only allowing the medication to be given to adults in Franklin County. We are working with the school systems now. Medication, or the flu vaccine, will be distributed in schools. So we're concentrating primarily on adults in this operation. Again, they'll be assigned a lane. The administrative assistant will receive the registration form and record it, and the nurse will administer the vaccine. At 7:30, whoever is in line, we will ask the police department, it's another one of our partners, to put a police cruiser at the end of the line, and that will signal for all of us that the operation is over. So that will end the operation. If they are not in line in front of the police car, then they're going to miss the flu shot this season.
Two multiple and one single. And the one single, to be able to give the vaccine, we have to ask first. We have to say, do you mind if...
Brittany No, accreditation coordinator with the Franklin County Health Department, and today serving as volunteer coordinator for the 3 for Free drive-through flu clinic, is joining us. Hi, Brittany. Thanks for being with us.
No problem.
Can you tell us a little bit about your role with this drive-through flu clinic?
Absolutely. People may think it's a nuisance to sign in. However, it's an extremely important in this exercise, even though it is not a real emergency. It's extremely important that we have a head count of who all is here, and then a sign out of when they leave. That way everybody is accounted for, and that we get a good representation of our community partners that's involved in this program as well.
I think it's those little details that a lot of times when things go down, or you do have a mass emergency, that just aren't, maybe aren't considered. So planning ahead for that's really good. Thanks for talking with us.
No problem.
Okay, go ahead. Terry Magel, Board Chairman for the Emergency Food Pantry of Franklin County, is here joining us. Hi, Mr. Magel.
Hello, Debbie. How are you?
I'm doing great. Thanks a lot. Can you tell me a little bit about how the Emergency Food Pantry participates in the annual drive-through flu clinic?
Well, Debbie, you know that children that are hungry are susceptible to disease, and our problem here in Franklin County is that we have quite a number of children who go hungry, who are food insecure. And the partnership that we have with the Franklin County Health Department is a good one because it combines both health flu shots with the food donation that people are bringing three items of groceries to the flu shots event here, and it's helping children to fight to maintain their immunity against disease. So this is a really good partnership, I think, that we hope we've done this now for approximately 3 or 4 years, and we hope to continue this.
I think it's always amazing when we come back after the clinic is over with and, we get these reports on the amount of food that was donated. Do you have any idea, just maybe from year to year or even last year's number, how many truckloads of food?
Sure. We've collected somewhere in the neighborhood of 3,000 to 4,000 pounds of groceries at each one of these events. And it's a fabulous, it really helps us quite a bit.
It's a creative partnership and use of an event.
Yes.
So we're grateful you guys are here as always, and we wish you luck as the holiday season's getting ready to roll in.
We appreciate the health department's willingness to partnership with us, and we're working with the Kiwanis members. As you can see, there are 10 or 12 Kiwanis Club members who have always helped us in the past, and they're devoted to our mission of feeding the hungry as well. So it's really a great event. It brings a lot of different groups together. So we really appreciate it, Debbie. Thank you very much.
Thanks so much.
You're quite welcome.
Cindy Copenhaver, branch manager at the Sauer Boulevard Commonwealth Credit Union, is joining us now. Hi, Cindy.
Hello.
Can you tell us what a financial institution would do as far as a drive-through flu clinic? What is the role of the Commonwealth Credit Union?
Well, we partner with the Franklin County Health Department because this is the pandemic site for if there were any emergencies in our community. So they can come in and take over our location and use it. And this is a test for if that were to happen in the future. And of course, on the other hand, then we use it as a marketing opportunity to let people know what we offer. So we work together to take care of the community.
It's definitely been a terrific partnership that we have enjoyed and are so grateful for you all.
We've enjoyed it too. We actually enjoy coming out here and doing this and getting to see the people and being a part of it. So thanks for letting us be involved in it.
Thank you. Jennifer Bardroff, environmentalist with the Franklin County Health Department, is serving the role as volunteer and registration coordinator for the 3 for Free drive-through flu clinic. Hi, Jennifer. Thanks for joining us.
Hi, how are you?
I'm good. Can you tell us a little bit about the paperwork that our participants receive when they come through registration?
Absolutely. When they come through, they'll be getting a clipboard, and on that clipboard is the registration form and information on the influenza vaccine itself. It's just a fact sheet so they can get some idea of what it's about, and then the registration form is what they will give the nurses when they go up to the dispensing line.
Now, what kind of information are we gathering and the purpose of it? I know we get their name and so forth, but because we're giving a vaccine,
we find out a little bit about their health history too, to make sure that they're not allergic to anything that would cause a problem with them getting the influenza, the flu vaccine.
Very good. Well, thanks so much for all you're doing out here.
Thanks, Debbie.
Tammy Bertram, the Director of Nursing at the Franklin County Health Department, is serving the role of Operations Manager for the 3 for Free drive-through flu clinic. Hi, Tammy. Thanks for joining us.
You're welcome. Thanks for being here.
Can you tell us a little bit about the flu vaccine that our customers are getting this evening?
Well, we have 2 different kinds of flu vaccine. We have the regular flu vaccine that we're given to people who are under 65, and then we also have the high dose for the over 65.
Now, why is it important that our residents are being vaccinated annually for the flu?
Well, about 35,000 people die a year in the United States from complications from the flu. So it's really important. People don't realize that the flu is a major virus and that you can get really sick and actually be hospitalized and that death can occur. So it's really important to get your flu shot every year.
Now, in the event, of course, our viewers tonight aren't going to be able to join our flu clinic live, but can they come into our health department and get their flu shot there?
Yes, they can, and you really don't need an appointment. You can just walk in. We'll give the flu shot. We do have a couple of different kinds at the health department that we don't have here tonight, so just come in and tell us what you'd like, and we'll get you your flu shot.
Great. Well, thanks so much, Tammy.
You're welcome.
Sally Brunner, nurse supervisor with the Franklin County Health Department, is serving as dispensing coordinator for the drive-through flu clinic. Hey, Sally.
Hi, Debbie. How are you?
I'm good. Can you tell us a little bit about how this traffic flow works at the dispensing lanes?
Yes, I can. We've done this a couple of years, so we've gotten pretty good at that. We have it organized in lanes, and so in one lane we'll have multiple people in the car who need to get flu vaccines. In another lane we'll have single persons who want a flu vaccine, obviously the driver probably. So we have more staff at the multi-car lane, and there are nurses and support persons or clerks who attend to both sides so that they can quickly dispense the medicine. The clerks will talk to the client about their paperwork that they've already filled out, make sure that they've answered all their questions and consented and signed, and if they have any questions, then the nurse is there to answer those questions. Then they just kind of pop their arm out there and we give the vaccines and they're on their way.
This is really great, very convenient. They can be in the comfort of their own car and so forth.
Especially when it's a little chilly like this. It's a little chilly outside, so it's nice not to have to get out of the car.
That's true. Thanks so much for sharing this with us, Sally.
You're welcome.
Lieutenant Lynn Aubrey from the Frankfort Police Department is joining us tonight for the clinic. Hi, Lieutenant Aubrey.
Hi, how are you?
I'm good. Thank you so much for being here. And if you could tell our viewing audience what role the police department plays in a drive-through clinic.
Well, we're providing security as well as traffic safety for the workers and the people that are coming into the clinic. It's also a training exercise for us in case there ever was a mass event. It helps us prepare, practice to know what our role would be and what part we would play in that event.
Well, we're definitely grateful for you all and for the Frankfort Police Department and the collaboration that you share. Thank you so much.
You're welcome.
John Lyle is the Emergency Preparedness Coordinator with the Franklin County Health Department, and tonight he is serving as Safety Officer for our drive-through flu clinic. Hey, John.
Yes, Debbie.
Could you tell us a little bit about the drive-through flu clinic, how it got started, and the purpose of this drill?
The reason why we do this is a twofold effort. First of all, we're testing our capabilities for the National Strategic Stockpiles distribution system. This is where the federal government will send medication to our county if there's a bioterrorism incident. What we're doing today is seeing how quickly we can dispense medication. So we're exercising our ability, training our personnel, but then also we're protecting the community against influenza.
Interesting. Well, it's been really great to see how the process rolls out and all of the different partners that are involved. So thanks so much for what you're doing here.
Well, thank you very much, and we thank our partners. Without our partners, we couldn't do this, and everyone is very gracious and very cooperative in helping us carry this out.
It's quite a big event. Thanks, John.
Thank you.
Judy Mattingly is the director of the Franklin County Health Department, and tonight she is serving as incident commander for the drive-through flu clinic. Judy, thanks for joining us.
Thank you for being here. We're really excited to have you.
Well, this has been an amazing event. It's been nice to see all the traffic through here, rather successful. And everyone that we've spoken to has talked about the partnerships and the collaboration. Can you tell us a little bit about who's involved that makes this possible?
Definitely. This event would not be possible at all without our community partners. We have so many different people working here tonight. When you first start to come down the East-West Connector, you'll see that the road department, the Frankfort Road Department, has been so gracious to put up their electronic signs and all of the coning to keep all of our participants safe and to keep our volunteers safe. The first stop our participants make is with the Kiwanis Club. They are collecting food for the emergency food pantry. And then CCU, who not only loans us their drive-through banking lines, but they also have goodie bags for all of the participants. They're such a great community partner. And then the next stop for everyone is at registration with the Red Cross. Every single year they are here and they help us to exercise this response plan, and they get everyone registered. And as the participants come around the loop on Sauer Boulevard, then we of course have a lot of the health department staff there, and they're going to see a lot of our Frankfort police officers out in force, making sure that we stay safe and that they stay safe. And then finally, when our participants get to the drive-through lines where they're actually getting their shots, it's not just our health department staff, but a plethora of nursing students from Kentucky State University. And I want to make sure I did not leave anyone out there. And of course, emergency management here is here as well as the Frankfort Police Explorers that are also helping to direct traffic with us. And I think that about covers everyone. So you can see it takes a lot of community partners, and if there ever was a real emergency, it would be the same thing where all of our partners would be collaborating together.
Well, it's definitely a joy to have everybody out here and to be able to collaborate with so many great departments and divisions. So thanks, Judy.
Thank you.
I'd like to thank all of our guests for joining us today, and I hope you at home are more convinced than ever that your community is working together to keep you as safe as possible. If you have something that you'd like to hear us discuss or a topic you'd like to have us address for Working on Wellness, please feel free to visit our website at www.fchd.org. Thanks, and I'll see you next time.